Hello there and welcome to this video. In this video, we're going to talk about the commonest fear that most people have when they're dealing with health anxiety, and that is what if the doctor has missed something? Have you ever walked out of your doctor's clinic with a normal ECG or normal blood reports, yet instead of feeling relieved, you're feeling more confused? You're feeling anxious, and the next thought in your mind is now, whom should I visit next? Now, where should I find the solution to my symptoms? Who is going to tell me what is wrong in my body? Because this doctor wasn't able to find out what the problem is. If this is the loop that you're presently stuck in, then this video is for you. I was also stuck in this loop for a couple of months when I was in the thick of heart anxiety. So, when I first had my palpitations episode and all the tests were done, and the cardiologist told me that everything is fine with my heart, I was not convinced. I didn't believe him because I was having chest pain, palpitations, breathlessness every day, several times during the day. I just didn't feel healthy in my heart. I felt that something is wrong in my heart, and yes, the doctor has got all tests done, but my symptoms felt very real to me. And I was just not convinced that anxiety could produce such real symptoms and so many chest symptoms. The heart rate was actually high, the chest pain felt real, the breathlessness felt real. I knew I'm not imagining this. Yet, to be told by my doctor that nothing's wrong with your heart, it's absolutely healthy, I just didn't believe my doctor. And that's because anxiety feeds on uncertainty. And when it comes to health, you can never be 100% sure. So every day, this voice in my mind that the doctor has missed something just kept getting louder and louder, and my anxiety kept getting worse. And anybody who's dealing with any kind of health anxiety, this is the most prominent thought in your mind. You get thoughts like, what if you did the test too soon? What if it's too early to detect and hence they haven't picked it up? What if the blood sample was not collected at the right time? What if the machine or the instrument that was used was faulty? What if the technician didn't do a good job? What if they didn't scan long enough or they didn't look long and hard enough? These are the thoughts that keep coming up, and you literally then take it on to yourself to find a solution or to find a diagnosis or a label for what is wrong with you, because the doctors are saying they're not able to find anything, but you know that something is wrong, and you then are on a mission to find out what is wrong with you. And then begins this deep dark pit of spending time on Google, searching forums, spending time on Reddit, asking questions multiple forums, randomly asking people, have you experienced symptoms like this? Who else is having symptoms like this? Oh, this is what I'm experiencing. Anybody else out there experiencing the same thing? And this goes on and on, keeping you stuck in this loop of health anxiety. So, we are going to look at what is it that we can do to come out of this space and stop asking ourselves this question, that what if they have missed something? So while I suffer from health anxiety for a couple of months, I was able to break out of this loop. And in the next few minutes, I'm going to share with you what is it that I did that helped me break out of this circle. The first thing was to accept wholeheartedly that anxiety produces a lot of physical symptoms. These symptoms can feel very real. Sometimes the doctor will also be able to make out that yes, you are having a symptom. For example, let's take the example of a tremor. The tremor will be visible not just to you, but also to your doctor, to your friends, to family. So it's a real symptom. However, you need to accept that if everything has been ruled out, anxiety can produce such real physical symptoms. Anxiety is a condition caused by hypernerves. Excess adrenaline and cortisol in your body can produce a lot of physical symptoms. So, you need to stop compartmentalizing every symptom. That, this is the digestive symptom. So, now let me go looking for a label and let's see if I need to label this as IBS or Crohn's or whatever else. Or this is to do with my heart. So, I need to label this separately. Once everything has been ruled out and you've been told that it's anxiety causing all these physical symptoms, you need to just look at it through this lens of this bubble of anxiety and not as separate groups of symptoms. Once you accept that, yes, all of these go under this umbrella of anxiety, it becomes easier for you to accept your symptoms. The second thing that you have to do is start your day with gratitude and especially be thankful for what's working right in your body. When we are having health anxiety, we wake up with the thought of scanning for danger. How is my heart anxiety today? What are the new sensations I'm feeling? If you're having tremors or if you're having nervous symptoms, then you look for the nervous symptoms. If you're having gastric symptoms, the first thing is how is my gastric pain? How is my stomach pain? So instead of scanning for symptoms, instead of looking for danger, wake up with the thought of being thankful. Especially be thankful for three things that are working right in your body and make it a habit to write this. For every little thing, for being able to walk, from being able to speak, from being able to smell things, just write three things that are working right in your body and make it a habit to do this as soon as you wake up. This will train your brain to think about positive things or to be thankful for things or to look for something positive as soon as you wake up instead of scanning for danger. Because if you're in the thick of anxiety right now, you will know that in the morning when you wake up, your brain is tuned to looking for what's wrong, what's not working right. So, have a gratitude journal and write down things that are working fine in your body. Things like, my digestion is fine, I'm able to walk properly, I had the energy to get out of bed. Write it and read this several times during the day. The third thing you're going to do is that when any new symptom surfaces, pause. Don't rush to solve it. Now, this is a big one. Anxiety makes you believe that every symptom that shows up and every sensation that you experience is urgent, but it's not. It can wait. You need to decide how much time you are ready to wait. I would say something like 2 weeks is a good enough time to see where the symptom is going. Obviously, if it's something that's so urgent, like you're bleeding from somewhere or something that's by now you know what's urgent and what's not. But otherwise, if it's a new symptom, decide to wait. Decide to not do anything. Give yourself 2 weeks and see where it goes. The body is capable of doing a lot, and the body can handle most of the symptoms that come up and resolve it on its own. You don't need to be in a hurry to discuss your symptoms with anybody, to Google them, to go onto YouTube and find solutions, or to book an appointment or get any tests done. I would suggest that 2 weeks is a decent enough waiting time. After that, if the symptom still persists or gets worse, you can then decide what you want to do about it. But don't be in a rush to solve or to attend to every symptom or sensation that shows up. When a sensation shows up, you need to ask yourself, have I felt something like this before? Has a symptom like this been there before and did it pass on its own? This pause will give your body the time to heal without fueling further fear. The fourth thing that I want you to remember is that time is the best test, and you need to be able to use time as your evidence. If you've got tests done in the past and the symptoms have not worsened, they've remained just the same, then that is proof that nothing is wrong with you. The fifth and the final point is learning to accept the uncertainty and to live with it. So, in anxiety, as I mentioned earlier, we're always looking for that certainty because when we are uncertain, when we are unsure, it's uncomfortable. It brings in a lot of uneasiness. But when you accept that uncertainty, that the thing that we started with, that what if they have missed something? If your symptoms continue to remain the same and your condition is not really deteriorating, it's the same thing, you've been checked repeatedly, you've been told that everything is fine. What if you just sit with it and accept that, yes, maybe there is a slim chance that something has been missed. They have not picked up everything. So what? Can I sit with that uncertainty? Can I accept that uncertainty and live with it? And this really becomes a game changer for you in terms of anxiety for a lot of things, because that's what it is. It's about it's about being okay to deal with the situation when you get there, rather than thinking that what is it that I can do now, and think of all the permutations and all the possible situations that can happen in the future, and then I'm mentally trying to prepare myself to deal with that situation. That's what makes anxiety go from bad to worse. So if instead of thinking about all the possible future scenarios in the present moment, I tell myself that let me just accept what it is, and let's just say that yes, they have probably missed something, and if I've done everything that I possibly can to get it checked, get everything ruled out, now instead of twiddling my fingers and thinking, what is it that I can do? What is it that I can do? And losing sleep over it, why don't I just accept that maybe they have missed something? And if they have, and something then comes up later on, I will deal with it when it comes up later on. Right now, I'm not going to lose sleep over it. Right now, I'm not going to make myself anxious over it. I'm going to let this be and deal with it when it comes up in the future. This can really be a game changer for you, not just in terms of health anxiety, but in terms of anxiety overall in the entire picture of your life. It can change things for you. And now I want to circle back to where we started, that if you are one of those people who is stuck in this loop of what if they have missed something, I want you to know that you're not crazy or you're not being over dramatic. You're just a person who's scared, as I was too. Our brains are just trying to protect us, but they're doing it in a way that is keeping us stuck. So we need to remind ourselves that healing starts when we stop chasing certainty and we start building trust in our body. Figure ways and find ways to rebuild trust in our body, to believe that healing is possible, recovery is possible, and we are capable of feeling fear, of sitting with fear without needing to fix it. The fear need not be fixed. We can sit with it without letting it make us paralyzed. I want you to tell me if this video has helped you in the comments. Please share this with anybody whom you think will be benefited from this. And I'll see you in the next video. Till then, take care of yourself.